on behalf of the Swiss National Research Foundation, on behalf of the Swiss Tropical and Public Health Institute, on behalf of NADEL ETH Zurich, and on behalf of cinfo, the Center of Competences of International Cooperation, I would like to welcome you to this very special event this afternoon here in Basel.
Over the last 10 years, thanks to the support of the Swiss Agency for Development and Cooperation, the Swiss National Science Foundation, the r4d program supported 57 projects, 13 synthesis projects, 13 transformation accelerating grants, leading to a worldwide network with a lot of results and innovations.
How this r4d project has moved forward and really generated data and evidence-based that is based on sound scientific inquiry, taking science to impact, not just pursuing science in an ivory tower, but then try to develop public health actions derived from data generated in a multi-stakeholder way. And here is also where the colleagues from NADEL come in. It was a perfect partnership to move forward together and of course with the partner countries.
There is one finding that I want to highlight here that was consistent across all papers, quantitative and qualitative. And it is the equity thing. Meaning that if you are or the part in a community that has a better socioeconomic status is more likely to benefit from extractive projects compared to those with a lower socioeconomic status. They may even be worse off with such projects being developed in their communities. And that's of course a huge public health concern that needs special attention from both the public and private sector, in my honest opinion.
We see two overarching agreements. The one is across all stakeholder groups, private sector, public sector, civil society, in all 4 countries there is an agreement. The status quo is not sufficient. We have to move on and we have to find better, in the sense of more effective regulatory approaches.
I'd like to talk about this situation in and around mines. What are the positive and negative impacts on the communities in those countries? We'd like to talk about the problem of how we deal with weak states that are not able to enforce health and environmental protection standards, how we deal with that issue to improve the situation nevertheless, and what solutions can private and public partnerships offer or not.
I mean, it's really essential, I mean, that the governments are those who have the obligation to provide health services for their populations. And I think it's about strengthening health systems. And we have seen that there was little progress. I mean, especially in northern Mozambique. I mean,
given the fragile states and the fragile Mozambique, and Mozambique, you know, is massive, but it's one of East Africa's most fragile states, and corruption is rampant. Even in those cases where there is a bit of capacity to implement or to enforce some of the agreed aspects that companies should observe, that is often not the case. In Tete province, where the responsibility from the state and the responsibility from the private sector to protect, to ensure that explorations are consistent with a sound, healthy for local communities. Local communities, they don't protect the overall areas for local communities, and this is problematic.
So legislation is one way to address things, but it's as well not the only one, because companies, if they are not closely associated in finding solution, in developing a legislation, they will probably find a way to avoid it. After, how do you control that companies respect human rights, I don't know, in the DRC, in the cobalt industry? That's as well not so easy.
The biggest case that I'm still following up is a traffic accident. So it's really like it was shown before in the numbers. It was 3 years ago, a big truck with acid covering a transporting acid to the mines, had a traffic accident.
Flows down that chain to the health post on the ground. There is the question of revenue mobilization and taxation. If there's no money, there's no provision of services. And it's a risk area for companies if they're then asked to, say, build a hospital or provide this, that or the other, because that's capital expenditure, but it's not the operational expenditure that actually delivers services.
At the moment, it's often not defined what is the responsibility. Like that hospital, they pay taxes, so is the public sector financing the strengthening of the local health system, or is it the responsibility of the company? This is, in all contexts we have worked, not well defined. I think to actually resolve this issue would also help very much.
Research is essential for what we're discussing here, because we need at minimum baseline information on what's the situation where these companies will operate. And from there you need constant monitoring. And what I also found interesting to hear is that the companies do have a role in what happens after they establish. It's not just a matter for the local government to take care of whatever happens.
Stopped doing its work because of a lack of funding. This organization was produced an index and gave rankings to industrial mining companies, including gold mining companies, and all of them ranked really low. Some of them ranked incredibly low. We're talking about like 3 to 6 points over 100. And the best one, if I remember correctly, ranked 32 or something, but there was just one.
Thank you so much for being with us. You were very, very active, replying and also asking many questions. So thank you so much for being with us.